and today's topic will direct towards the understanding pathophysiology, the sequelae that the patients go through, and what are all the recent advances that we have to overcome these things. So, burns is defined as a thermal trauma to tissues caused by a variety of agents. As we all know, when it is caused by hot water, it's called scalds. When it is flame burns, and chemical and electrical, as the name explains. Why do we need to know the causative thing? So, we know the prognosis. One of the way to assess a burn wound is to know the causative agent. So, when you look at a scald, which usually happens in the extremes of age, like children or in older individuals, so you know that all you need to do is prevent infection and prevent friction. They have a very good prognosis. And in children, we almost always use collagen as a skin substitute, and so that you don't have to do dressings every day. So, scalds, when you know that this is how this is going to go, for the next 1 week, if you are careful, the patient is going to come out without much of a scar. Flame burns, on the other hand, we all know flame is not containable, so it is, you cannot predict the extent usually. It almost always indicates some kind of resuscitation and relatively poor prognosis depending upon the surface area involved, and almost always some form of surgery is required. Coming to chemical burns is one of the most disfiguring of all the burns, and usually either as lab accidents or as an act of revenge, and so it's almost always happens on the exposed part and especially the face, and causes disfiguring, needs multiple procedures, and you can say with the current options available, they never get back their original face, but we are still trying. Coming to electrical burns, depending upon the voltage where the injury happened, they have a cardiac arrest if it is close to the chest, or if it is through the peripheries, they end up with multiple amputations. The resuscitation formula again is different for this because they may not visually, you may not see much of a burn area, but wherever the current has passed, it would cause damage, so they end up with multiple amputation. And it is distressing because it invariably happens in younger individuals who are socially very active, probably the earning members of the family. It also has a poor prognosis. So, whenever you have an injury, like any injury patient, you have to do a primary survey for life-threatening emergencies, like a person who is in an electric pole having an electrical injury as well as a fall. The precedence, you have to treat the head injury first, and so you have to assess them for all the other life-threatening injuries they could have survived, and do the secondary survey for comorbid conditions. So, every disease has a prognostic indices. There are factors which point to them. Here in burns, it's usually the depth of the burn and the causative agent and the body surface area. The other relative indicators being extremes of age don't do well, pre-existing medical conditions, associated trauma, presence of associated trauma like blast injury, fall injury also contributes to the prognosis. So, these three factors are the ones that give you the prognosis: the type of burn, the percentage of burn, degree of burn, what caused the burn, and how much of percentage of the body is affected, and the degree. Is it first degree, second degree, or third degree? We will be discussing it in detail. So, how do you calculate the body surface area? In a mass casualty, when you want to immediately start a resuscitation, rule of 9, each region has 9%. That is easy to do, and more elaborate learn and broader once they reach the burn unit can be done. And this is very important, especially in extremes of age, to calculate the fluid.